Talking about herpes simplex encephalitis is Professor Tom Solomon from the Institute of Infection and Global Health in Liverpool, the United Kingdom.
Hi there, my name's Professor Tom Solomon and we're here in Liverpool on a rainy Sunday morning. I'm the Professor of Neurology here at the University of Liverpool and at the Walton Centre, and I have with me a patient of mine, Yvonnes, and her sister Lisa, who we'll be talking to shortly. But just to give you a bit more background first of all, so one of my roles is as the chair of the Professional Advisory Panel for the Encephalitis Society. And it was in one of those meetings that we came up with this idea for the international webinar for World Encephalitis Day. We wanted to show that this is a disease, people are aware of it in their own part of the world, but we wanted to show that this really is a global problem. And we came up with the idea of doing 5 interviews of 5 case studies, if you like, from 5 continents, showing where encephalitis happens. And although it's caused by a range of different pathogens, a range of different bugs, the end problem is often similar. So far I think we've heard from Australia about encephalitis caused by enterovirus 71, and my friend Ajit, I think, has just finished talking about Japanese encephalitis in Nepal. Hi Ajit. Like to say hello to Ajit?
Hello.
Hi. Hi, Ajit.
Okay, and hello to everyone else that's out there. So, in the UK here, we're going to talk about herpes simplex virus encephalitis, which is one of the most common causes around the world. And unlike the diseases you've heard about, enterovirus 71 and Japanese encephalitis, which causes big outbreaks, herpes simplex virus is a bit more of a silent killer in a way, because it just causes disease at a pretty constant rate all over the world. And so perhaps it doesn't get quite the same attention, but when you add up all the numbers of patients, it is a big, big problem. So talking about patients, Yvonnes is a patient of mine who had herpes simplex virus encephalitis in 2013. And we thought we would start by hearing her story, and then as we go along through the story, we'll interrupt to explain some of the issues that come up. Does that sound okay?
Yeah, definitely.
Good.
Great.
Okay, so I mean, let's start with back in 2013. Well, let's start with you actually. You're a teacher, aren't you?
I am. I'm a teacher, and it was a very ordinary weekend, and I had my husband and my daughter and my dad coming for tea on a Saturday night, and I love my food, and the weird thing was I put food in my mouth and I had no taste in it whatsoever, which is unheard of. So we kind of laughed. It didn't seem that serious at the time. And then on a Sunday morning, I began to get pain in my right hand and my left foot, and suddenly it began to seem more serious, and I started vomiting on the Sunday. And we went to an out-of-hours doctor who sort of said, go home and rest at the time, and see your own GP the next day. And thankfully, my husband stayed off, and the next day my speech had started to change. And we had a GP come to the house who had known me since I was a little girl. And he asked me very simple questions like, what's the name of the Queen of England? And I apparently looked at him blankly, and I couldn't answer simple questions. And he had had a patient with encephalitis. So he phoned our hospital and said, I think she's either possibly got encephalitis. Can you take her in? And that's where I came into the Royal Hospital. And it began, and weirdly then, once we got into the Royal, my memories after that are very vague. I think I literally just got in time. I was very, very lucky.
Right, okay. And we'll come back to that and how quickly you got into hospital, because you clearly did very well in that sense.
Really lucky.
Lisa, what do you remember about what some of the problems were?
I just remember Yvonne saying she felt very ill and wouldn't like anyone else to feel like that. She was conducting the conversation quite well with me. She told me she'd been to see the GP, but she'd started to lose some of her words when she was talking. And I actually went with my husband and took her into hospital. And in the car, I remember her clearly saying, are you Ian, to my husband? And we thought, that's very strange. Known Ian for as long as she's, 20 years or more. And the fact that she'd started to lose that bit of memory as well. We went into the hospital. We were in the hospital a while, and we thought I privately thought she might have had a stroke. And initially they thought the same, but we did have the stroke nurse specialist who came around, and she said that's not quite right, it doesn't fit with stroke. It got late, so I had to leave Yvonne. But I know they took her onto the ward and they did a CT scan of her. And the following day, they did an MR. No, it wasn't the following day. A couple of days later, they did the MR. But I still thought she was possibly having a stroke. She had moments of absence when we were visiting on the ward, and I did get very worried and speak to the doctors. And they actually took her down for an MR scan eventually. And actually, she seemed to pick up after that.
Up. I remember.
Yeah.
She perked up for a day or two.
Yeah,
didn't she?
and we were all really pleased. And then the consultant came in. Wasn't yourself?
No,
somebody
it's an
else.
infectious disease consultant. We work very closely.
And
with
he
them.
said, "Well, this is a very strange disease. This," he said, "because you can make progress, but it has up and downs." And so we had our fingers crossed, but she did actually deteriorate, because I remember going in on the Friday, and she was really poorly. She was out of the bed. She couldn't speak by that point. She'd lost some control of some of her functions, the bladder control. And the Saturday, your husband was called in, wasn't he? Mark was called in, and I went in with them, and she'd actually started to fit.
Yeah.
But that was well managed, and I remember it was one of the doctors looking after Yvonne said, you know, he was really confident, and he said, "We know what's happening with Yvonne, and we're actually going to do some more advanced treatment. We're going to put her on steroids because her brain was swelling, and he said that will reduce some of the swelling." And so the afternoon progressed, and I remember an ICU consultant coming up to see Yvonne and to see whether she would need to go on to ITU. So we were very worried at that time. But he seemed to think that a lot of the drugs were sort of depressing her a bit.
Yeah.
And she needed to come out of that. And I remember vividly, we were trying to rouse Yvonne, and one sort of really lovely thought about it was when my dad actually said, Yvonne, and it was him she responded to, and she said yes, and her head flew back.
Right.
So we felt really positive, because we knew she was there and she was coming back to us, you know.
Right.
So that was lovely, and so she began to make progress back, but she was at quite a basic level, really.
Yeah. All right. Well, let's go back through some of that then in a bit more detail.
Yeah.
So, I think first of all, the symptoms of encephalitis. Had you heard of encephalitis before you had it?
Never heard it before. No.
I'd heard it because I work in the Walton Centre, but I really didn't understand about it at all.
Yeah. So, and one of the reasons why we're doing World Encephalitis today, this is our second World Encephalitis Day, is just to raise awareness. And we've had so there's been a lot of interest in newspapers, on the Twitter sphere, I believe it's called. And so one of the big issues is raising awareness, not just among the public, but also among doctors and nurses about the symptoms of encephalitis. And so you were unwell with a generally a bit fluey, and then you had this thing about not being able to taste your food.
Yeah.
Is that right?
Yeah, and definitely, and like I say, taste was weird, and then hands and foot, and it just seemed weird. Trying to put, how does this link in, and then vomiting as well.
Yeah. Am I right? Did you have a fever before this or not?
I don't think so.
Sure.
No.
You hadn't had a fluey illness or anything?
No. The only thing, which sounds absolutely bizarre, I'd had a bit of grief before this. I'd had a dog put to sleep, and I went back to work the next day, absurdly, prior to this, which sounds absurd, but I was very stressed at this time. I wasn't myself at that time. She was like, this little dog was my little baby kind of thing. And I do think about looking on that, I think it was that compounded with work stress and things like that. At the time, I think I was quite stressed.
Yeah. We don't actually know why people develop this disease. Herpes simplex virus is a very common virus that causes cold sores, and everybody knows it for that. And it people get the virus when they're young, and then the virus goes away and hides up at the back of the face in one of the nerves there, and then, as you know, people can tend to get cold sores when they're stressed. That's often when the virus will come down and cause a cold sore on the lip or mouth. But for some reason we don't understand, sometimes it goes the wrong way and causes, if you like, a cold sore or inflammation, swelling in the brain. So you basically had odd behaviour and funny feelings in your arms and legs, and that's one of the symptoms of encephalitis, is just strange behaviour. Then you went on and had a seizure,
Yeah.
and that's also one of the other things that often happens. So typically for herpes encephalitis, someone will have had a flu-like illness for a few days, and then they'll start to behave strangely, which you did, and then they may or may not have a seizure, and their coma score goes down, and they can become unconscious. So you had some of the normal features. I seem to remember there was a curry involved. Was it a curry that you were eating on the night?
It was that. Well, that was the weird thing on a Saturday night.
Yeah.
I couldn't manage to eat.
Couldn't manage your curry, yeah.
Unheard
So
of.
clearly something was terribly wrong. That we in Britain, we all love our curry on a Saturday night. It's traditional. Okay, so those were the symptoms, and you came to hospital quite quickly. Your GP had seen a patient with it before, but often, I mean, that was good, and we're pleased about that. That's, I think, one of the reasons why you've come out of the whole thing so relatively well. Often, though, one of the problems is that people don't recognise these symptoms because they can be very non-specific, and it can take people quite a while to get to hospital. And then even when they're in hospital, sometimes it takes a while to get the proper test done. Again, I'd like to think you were in our hospital over the road here, so it all happened quite quickly. But maybe at this stage we'll just go through what some of those tests are, just so that people understand. So you had a scan done on your head. Actually, maybe before we do that, I've got a few things here too. We talked about the virus hiding away behind the skull and behind the face. I didn't warn anyone about this. Is this okay? So have I shown you this before? This is a skull here. You can see it very clearly. And basically at the back here, there's a nerve that you can't see because it's not here, but it's called the trigeminal nerve, and that just sits here at the back of the face, and that's typically where herpes virus hides away. And if it comes down and causes an ulcer, then that's fine. It's a little cold sore, but that can be dealt with. If it goes up into the brain, the area that it often affects is here. Here's one I prepared earlier, as it were. Blue Peter. And the areas that particularly it can damage here is the temporal lobe here and the frontal lobe. And we'll come back to later on about what kind of problems that can leave people with. So we were talking about diagnosis, and you had a CT scan, I think, first of all. And a CT scan will typically show swelling in that part of the brain that I've just shown around the temporal lobe area. An MRI scan is a more detailed type of scan, which will show the swelling in more detail. And then I think you had a lumbar puncture, didn't you? Yeah. Do you remember having the lumbar puncture?
No, a funny way I have kind of snapshots in hospital. I can remember being taken for a scan. I didn't know why. There was little bits where I'd wake up briefly, it felt like, and I remember being scanned and not knowing why. And I remember on the ward, you didn't put me in intensive care, but you had 24-hour care for a couple of weeks, didn't you, there?
Yeah.
And the weird thing there was I would wake up and I constantly had nurses sat next to the bed, and sometimes they would have something they were reading, sitting on the knee, reading something, because they basically had to look at me, didn't they?
Yeah.
Or not, monitor me.
Yeah.
But even then, with nothing working, I look at them and think, oh, they could get in trouble for doing that. I remember thinking, bizarre.
Is that the teacher in you?
Yeah, I think so. I was still bossy boots, even though I was out of it. So.
Yeah.
Little tiny pinpricks of it. And I think looking back on it, what was weird is I didn't really even think about things like my daughter or anything like that until week 5 was the first time I began thinking, when the suggestion wasn't to go in a residential care place, wasn't it, when I left hospital?
Yeah.
And I think that was in the 5th week when I began to feel like me, because I remember thinking, where's my daughter?
Right.
And that was the first time, I think, when things began to click in, because it all seemed very, very, it felt baffling. It almost felt like when I came to, I didn't understand. I think I said this to you, why are we here and what's going on? You don't realise the severity of what's happening.
No. It's everyone else is around worrying about you, and you don't really know what's going on. So you had the lumbar puncture, the spinal tap. It's interesting you don't remember that, because I always tell my patients it's just a little pinprick, like giving blood, but it's slightly more than just a pinprick. So obviously you were only aware some of the time of what was going on. What the lumbar puncture does is it gives us the spinal fluid, which is the fluid that washes around the brain and the spinal cord, and it allows us to see what's going on there. It's the best way of looking. And in your case, what we saw were there were some inflammatory cells, some white cells, that tell us that there's some inflammation going on. And then also we actually detect the herpes virus with a test called a PCR, which is a way of diagnosing exactly what the cause is. And we find that herpes simplex virus is the most common cause of viral encephalitis in this country, in our setting. But of course, we often see patients with encephalitis from other causes, or patients where we don't get the cause at all. But it's very helpful to have the cause because some forms are treatable. Do you know anything about what you were treated with? You mentioned the steroids. Do you remember anything about before that?
Acyclovir, isn't that what they put on there?
Yeah, that's right. Acyclovir.
Yeah, exactly.
Acyclovir. After me, repeat. Acyclovir. Yeah, and that's so in the 1970s it was shown that this drug Acyclovir, this antivirus drug, stops herpes virus replicating and improves the outcome of herpes encephalitis. Without this drug, the outcome was very poor. About 70% of people died from herpes encephalitis. Now it's much less. It's probably about 10% that die. So you were given Acyclovir?
Yeah, Acyclovir.
And that's right. And usually that's all we give people, and then usually they will improve over the next few days. And I remember coming to see you. I think you were improving, but there was one of the problems was with your language, wasn't it? And do you remember what her answer to every question was? It was dog, wasn't it?
Yeah.
Do you remember that?
Yes.
We've got Yvonne's father sitting behind the camera. That's right, isn't it? So everything that she was asked, the answer was dog. Do you remember that? No. Okay, I remember that. And that was actually so. You looked like you were on the road to recovery at that stage, and you were at least conversing, and you knew a bit of what was going on. And then you did have this dip when you went downhill. When that happened, what did you think at that stage? What were your thoughts?
Negative thoughts. Really felt, really upset about it. I was just like fingers crossed, hoping for the best. But it did feel positive because we had good support in the hospital. So we were just looking to the professionals.
So we repeated your scan at that stage. The MR scan, and that showed that the swelling had actually got worse despite the fact we were giving you this antivirus drug. And so at that stage we did give steroid. We know that steroids reduce brain swelling. One of the problems though with steroids is that they also inhibit the immune system. That's the body's defense system. So there's always a slight worry when you give steroids. They may help because they reduce the swelling, but they may allow the virus to replicate and reproduce a bit more. And we're actually, so nobody really knows whether they work for definite or not. And we sometimes try them, but we are actually doing a study, a national study that we're just starting in the UK here to see whether steroids really work. And this is by giving some patients with herpes encephalitis steroid and by giving some nothing, and then comparing the outcomes. And that's going to be a study that goes on over the next 5 or 6 years. So you got your steroids. And things did pick up. What about, so how long were you in hospital altogether? Can you remember?
5 weeks.
Right.
Altogether. Came out on the end of the 5th week.
Right. And do you remember more about the recovery sort of in the later weeks and what it was like being in hospital?
I just literally remember the final weeks. What I do remember in the final week was wanting to go home, and that was the difference. Whereas up until then, it just seemed strange. It just like, it would literally, you'd have moments of waking up. My husband, he remembers one of the weird things was, he said, is when people visited, I would chat, but my speech was really, really weird. But he said when we brought my daughter in, who was 4 at the time, he said when she came in with him, I would go silent and I wouldn't speak when my daughter was there. And he said that's where he thought that was a bit of my brain working, that I still understood.
Yeah.
She would be upset to hear me talk rubbish. I wasn't being normal.
Right, yeah.
So, and he felt there was a bit of me still in there, even though everything had dropped. Yeah, I understood that how distressing it was for my daughter. So that gave him a little bit of hope at the time.
Yeah.
And like I say, I think the 5th week I came to a bit. And then the one thing I was obsessed with in hospital, one of the things I have found with encephalitis, you can remember the past far better than the present. But in hospital, I became apparently obsessed with Frasier, which bizarrely was on Channel 4.
TV program.
Yeah.
Right. Dear me, you must have been ill.
My dad had bought me a portable TV in the corner of the room, and bizarrely on Channel 4 at the time, they had 3 episodes of Frasier every morning. And that was the bit, I was completely obsessed with Frasier, of everything, of life that was going on. I had to sit.
Right, and watch that.
And that's one of my other bizarre memories of hospital, sitting watching Frasier.
Did you like it before you were ill?
I can't remember being this intense about it.
Right.
But God, we had to watch it constantly, didn't we?
What about now?
I don't know, I've got kind of fond memories of it.
Frasier saw you through your recovery.
Yeah.
So, and then, so this was a couple of years ago now, wasn't it, in 2013? And then tell us what's been happening since then, how things have gone on since then.
I think weirdly, getting out of hospital, the first 6 months were easier because I didn't really understand what was going on.
Right.
We had a situation, I didn't go into the kind of residential care unit, I don't know what you'd call it, you could have the support unit to help you kind of find your feet. And what they did in the hospital is that we met with I don't know whether it was yourself or someone else we met, and my dad and my husband met, and Lisa. And they decided that I agreed if I came out of hospital it was going to be 24-hour care until we met you for a review in March. So when we first came out, we had like a kind of system where my husband's employees were lovely, and they let him go to work late until my dad arrived to swap. So I had 24-hour care. So everything went really smoothly for the first few months because basically I had 2 people holding my hand all the way through it. And I still remember weird bits like with my dad. We used to go, but I used to sleep a lot. And then when I woke up, my dad would say, let's go out and we'll go and have a cup of tea somewhere. So we went round Liverpool. We ate our way around Liverpool, didn't we, basically? And I still remember weird things like my dad taking me to a cash point with a card, and I didn't know what to do, and he had to teach me how to use a cash point again. Right. That didn't upset me, but I can remember him showing me how to put a card in and put numbers. And then I can still got another memory of going in Next, wasn't it, Dad, where we went to get something, and my dad introduced us to a lady and said my daughter's had an illness, and then they got the little thing that you put a card in to pay for, and my dad showed me how to use the card and put my numbers in, and it's those bits which didn't upset me at the time. It all seemed, I just accepted that all this was going on. And then the harder bit was the second half of the first year, when suddenly I think as you begin to improve, I got a bit more, I want to do things by myself, let me do things by myself a bit more, and that's when things actually started going wrong. When I was independent, like we did things, I wanted to take the dogs out, so my husband found a thing, he could put a tracker on my mobile phone to see where I was, so he could watch me walk the dog. But I would do things like I fill the kitchen sink full of water to do dishes in my head, but then I wouldn't actually turn the taps off. So I went to walk the dogs, leaving before my dad came, the kitchen flooded. I had no awareness that I should have turned, and it's those bits were absolutely gutting. And I think the other bit that was hard in that first year, it was the need to sleep. It didn't bother me until the second half, when I had things like my daughter had nosebleeds in the night, and I got up and helped my daughter. And then we got up on Christmas Day, and we opened presents, and the fatigue element of encephalitis. She's opening presents, and I remember looking at it, and in the end, my husband said, I started to cry. What's your open? And he said, I need to go to bed, And I went to bed at 10 o'clock on Christmas Day, and I woke up at 3. And my husband's been lovely. He'd done Christmas dinner, and he'd laid the table out, and it was all beautiful. And I came in, and I remember thinking, I am so rubbish. And that's the bit
that's hard,
that gutting, where you just think, and he laid it all beautifully, and I was grateful, but you kind of think, I'm such a rubbish person, I can't do this anymore. And that was the first year. I think the second half of the first year, I remember getting to New Year's Eve thinking, is this as good as it gets after this? And I was much more aware. And then at the time I was in Mossley Hill Hospital, I was having speech therapy there. I had a wonderful speech therapist called Anna Money, who I'll never forget, who she taught me she was teaching me to read and write and things like that. And she says she was saying to me at this time, I used to meet her and have a little cry with her, because you can't cry in front of your family all the time, because you do feel you're a burden on your family as well. So I'd have a good cry with her, and she said the second year of encephalitis, you'll improve. Things do improve. And I remember thinking, she's just saying that to try and comfort me. But it was like a miracle. It was like the second year, from January, February, just bits of like short-term memory began to pop in. So whereas the first year I had really old things, like I met people I'd worked with, I had no recognition of who they were. It's like some lady I met who afterwards she thought I'd been rude and ignored her. And she told my friend, who then said, no, she's had
Yeah.
Encephalitis,
Yeah.
she doesn't know who you are.
Yeah.
And then the second year, I started to remember people. And even though I will have a long-term problem remembering names, I knew who they were. When I met them, I could recognise people.
Yeah.
And that was so uplifting. I felt like, oh my God, I am improving. And
Yeah.
I'd say for anyone with encephalitis,
Mm-hmm.
the second year you do what they say to you is true. Things do.
Yeah, it takes time. I mean, I think everything you've described is pretty typical. First of all, we often see that one of the things you can see, one of the big problems is you've had this terrible illness, but you look absolutely fine.
Yeah.
And so people don't, they don't recognise that you look okay, and they expect you to be okay. But then also people are so delighted that they've got through that terrible illness and that they're back out of hospital, that they then, if they're not careful, they rush and try and do everything. And then, try and get back to work, try and do too much, and then it all falls apart. So, I always encourage people to go very, very slowly, because it's much better to go slowly and be moving in the right direction than to sort of charge at it and have these big setbacks. But the other thing is the memory. Yeah, so often long-term memories from ages ago are fine.
Yeah.
But memories about what you did yesterday or this week are much harder.
Yeah, I mean, funny things, I didn't enjoy watching television anymore because I couldn't remember the story we were watching. I couldn't read, and I'm an English teacher, or I was an English teacher, but I found I could read words, no problem, and I could read a page, and I could have a go reading a chapter, but if I picked up the book the next day, there was nothing
remember what you'd read
at all.
Yeah.
And that was a really kind of weird feeling of those kind of things that upset you.
Yeah.
You think how can you pick up a book and not know what this is?
Especially as an English teacher.
Yeah.
Just remind me, what age were you teaching?
So secondary school it was.
Yeah.
So, but ironically, I'd done a lot with special needs students over the years.
Yeah.
And that was one of my big, but I did understand when they did with me in the hospital, learn to read and write again, or particularly writing, when they were saying things to me like, you need to read every day and you need to attempt to write every day. And I knew what they were saying was true.
Is that what you say for your school kids then?
Yeah, definitely. And that's what you'd always say, you need to practice. So what I used to read is I used to read the Mail online. My husband bought me an iPad.
Right.
And I could read an article, like a daft article.
Yeah.
So I would read something on the Mail online every day. And what they let you do on there is do a comment underneath the article.
Yeah.
So for my writing, I would write a comment on the article, which would take me, because you only write 3 sentences.
Yeah.
But it would take me blooming ages. But I'd write it, and they moderate it, so they only submit it if it's decent. And eventually, I think a couple of months down the line, they actually did one of my comments. And I thought, God, that is I can read so Mail online, I think. But people learning to do reading and writing again, that was effortless because you didn't have to remember it. You were only doing the article at the time.
Yeah.
So the next day, I wouldn't remember that article, but it didn't matter at the day.
Yeah.
So I did literally. I'd say if you've got with encephalitis, read and writing every day. They say this to you, but I did actually know.
Yeah.
I knew that did mean something, and that's one of the big things I did.
And some of the other practical tips, I think you found that if you were reading books on an iPad or a Kindle, other brands are available, then that was easier because you could click on the names of people and find out who they were, and you can highlight bits of the story. Is that right? Yeah,
definitely. I mean, that's been quite up until up to 6 months ago. I found I could read books that I'd read in the past when I was young, because I could still remember the story. New stories, I couldn't actually follow the plot day to day. But with the Kindle I got at Christmas, what you can do is you can actually, like you say, tip on a character, and it gives the previous chapters. It's been little sentences, they said, and that for me is enough.
Yeah.
To then carry on reading the book. And again, that's one of those moments you think, I can read. Read for pleasure is really lovely. Yeah.
What about watching films?
So watching films. Definitely, that's really improved. My dad watches lots of films with us, don't you? Here recently, but again with that one, following a plot in a film over 2 hours, I would lose the plot. But finding on the iPad, what you could do on the Wikipedia is actually do the plot description. So what we do, and in fact, my husband sometimes still does this now, and he hasn't got encephalitis. We can put the film on pause and have a quick read of the and it will summarise the plot for me, and then you can carry on following.
Where is Mark today? He's
with my daughter.
Is he? Okay. And the kids wanted to mention, didn't they?
She did.
You
Zoe
say
wanted to mention. Zoe, I'll say hi, Zoe.
Okay, so we've talked about books, we've talked about films. What other tips would you have in terms of to help people who have these kind of memory problems?
Definitely, the iPhone for me, it's been fantastic. I live on that. In that, you can actually put basically on every day. You can have alarms across the whole day, reminding you what to do. So I still have. It reminds me to take I've still got epilepsy following encephalitis. So I take that drugs for that twice a day. Now I tend to remember the morning one, but the one at 6 o'clock I always forget.
Right.
But the phone rings and tells me to take the epilepsy drug, and it rings when I see my dad in the afternoons. It will ring and tell me to pick up my daughter.
Yeah.
And all those appointments, because if it's not, without that reminder, that's where life goes a bit haywire. I have a big whiteboard in the kitchen which I write things on, which I need to remember to do.
Yeah.
And what I have realised, my memory definitely feels almost normal now a lot of the time.
Yeah.
But I think it's because lots of things are in place to remind me to do things.
Yeah.
And I think in recent weeks, say for example, my husband's worked away. I've been to work, working in the mornings now. And with the daughter, when I'm tired, my memory lapses.
Yeah.
Now what I find, so I had a situation where I went to get my epilepsy drugs from the chemist. And she said, "You've already been." And I said, "I haven't. I think I haven't actually." She said, "No, you haven't." She went through, and sure enough, I saw my signed prescription. I had been, but because I was very tired that week, my memory had dropped. And what I hadn't done is what I need to do is write on a board.
Down that you've been,
So I think it's sort of definitely, it's just recognising that your memory is poor.
Yeah.
But once you put things in place, your life can work, definitely.
That's a very positive message. And the other thing people do with their little phones is take pictures of people. I get this a bit in clinic. People who can't, they want to be able to remember the face to go with the name. And you can just do that, and then in your contacts, so you store the face with the name together, which is quite helpful if you're struggling to remember. I think you said you recognise some people, but you can't remember the name.
Yeah. I mean, one of the things they said in again, speech therapist said to try and remember if you can remember pictures. So if you can associate a name with a picture. So for example, one of my neighbours who I've known for 10 years, to remember her initially, I could think Princess Margaret, and she's Margaret. Yeah. And the guy I work with is Scott, and I know him because I picture him in a kilt.
Right. Yeah.
So it was just doing.
Very happy to know that.
So you do pictures to do with people can actually help as well at the very beginning when your memory's really, really poor.
Yeah.
I think as well, you do have naps and rest periods in your week, don't you? Like Sunday morning will be your rest period, won't it? And you sort of recharge your batteries, and you might have a little sleep when you come home from work. And also the fact that you work in the morning when she's at
her best.
Yeah.
And so you're not working as a teacher again now in secondary school. Tell us what you are doing now.
No, I'm working in a school library at the moment, because my big problem with teaching would be doing a meeting in the night time. Like even doing this in an evening, I'm not the same anymore. I'm meeting 30, say for example, a parents' evening meeting 30 parents. And having to remember the child, what level the child is working at, and having a spontaneous conversation 30 times.
Yeah, it's hard work.
That would definitely be gone for me now. But what I do is I work in a school library where I still do some support with students needing a bit of extra help. So one-to-one is an absolute pleasure, and that's all still there. I can do that with them. And then within the library, it's basically a large centre study area for sixth formers. So I still have a lot of contact with teenagers, which is nice, which is my pleasure. Yeah.
I think you told me that one of your problems is that if it's noisy and you're writing things down, you find that you actually start writing not what you want to write, but the words that you're hearing. Tell us about that.
Yeah, that's a real problem for me definitely with teaching. All the way through this, what I found is when there's noise, my ability to cut out noise now seems to have gone. So, for example, if we're watching telly in the night time or watching a film, if I want to speak to my husband, what we end up doing is we put the television on pause. And then we have the conversation. We're so used to this now, even my daughter who's 7, if she's going to speak to you in the night time, I'll put the telly on pause.
Talk to you.
And oh, Mum, da-da-da-da-da-da, and then we put it back on again and we carry on talking. So it is... What was the other thing then?
So it's about when you're writing and words will just, you hear words just come in.
Yeah, definitely. If I'm trying to write, if it's quiet, I can write, definitely.
Yeah.
If there's noise, say if someone was speaking over there while I'm writing, I'll actually put the word they're saying into my sentence. But the scary thing is I can proofread at that minute and I can't see the sentence. So say, for example, in work now, I would never do a formal piece of writing and send it. The one time I've done an email in that kind of situation, it just looks strange, combinations of words. So I think just recognise it's writing, if it's not being done in silence, no, don't send it off.
Yeah.
Leave it, and then
Yeah.
come back 10 minutes later. And weirdly, I can proofread
Yeah.
from a gap of time
Yeah.
and see a mistake, but I can't. I
Yeah.
can't see it, which is weird for me being an English teacher.
Absolutely. Yeah.
These are the barriers where
Yeah.
I can't get back into that.
And so Lisa, what else have you noticed in terms of how she's improved over the last couple of years?
Family situations, isn't it?
She wouldn't go to any family situations because of the trying to follow the conversations with everyone. Initially, when she was really unsure about being in groups of 5 or more, because you'd lose the thread of the conversation.
Yeah. Okay.
So but now she's even popping out at night.
I've had in the past few months,
Yeah.
had my first nights out. First nights out without family as well, which is
Right.
like being a teenager kind of thing. I think first time I've had it, it started in autumn. I went out with my best friends from I've still known from school, and it was funny because he started saying goodbye. Bye to my husband, feels like my dad. Bye.
You're allowed
I
out
go
on
off.
your
I got me walk down the road by myself, and I met the girls, and we had. I can't drink now because I'm on epilepsy drugs. But it's actually just that actually doing that social thing, sitting down. If I felt like I think the one thing I would say in encephalitis, when you do recover, there are lots of things you've always taken for granted.
Yeah.
Which when you're able to do again, are like, oh, this is like going out for a night with girls for a
Yeah.
meal.
Yeah.
Suddenly seems like amazing. It's so lovely.
You said as well, instead of having pictures, you've had words. When she's been searching for a word, it's come into her head. And she said she's almost stopped the conversation because she's been so delighted that the words automatically come into her head.
She's remembered it.
Yeah, so you nearly wanted to laugh, haven't you? And
it would be. It's like if you're talking about a film or a book, and my classic conversation would be that book, and then we have to try and find ways to, the one that was, and we have long come now. Suddenly, sometimes, as you say, the book name will pop in, and you'll always be like,
yes,
yes. But it's lovely. It's really uplifting.
Yvonne, I would say, has always had a really positive attitude.
Yeah,
I
think that helps.
That has really helped. She's even when she's had things that have got her down, like the chemist the other day when she'd got a prescription.
Yeah.
She feels sad about it, but then she's positive and moves on.
And you've had a lot of support from your family and friends. What support from anywhere else at all?
I think probably I was lucky with my employer. When I knew I couldn't come back to teach, she actually gave me the chance to come back and try and be a teaching assistant just for 2 mornings, one-to-one. And even I said I'd struggle in a classroom full of people talking, and he let me do one-to-one on the first little step, and that sort of made me think I can. To actually make that step away from my family and the house. Yeah. I did that 2 mornings just on a temporary contract, and that gave me the first little foot. Then back in the confidence to apply for the job I'm doing now. Yeah. So that that someone giving you a chance like that changes your life completely. Yeah. And then my employer that I've got now knew I'd had encephalitis. Yeah. And it was just for a temporary contract to go in. But I was given an opportunity there by a very, very kind lady who agreed to take me on a temporary role there. Right. Which was going to be a teaching assistant kind of role there. Yeah. And
what about the society, the Encephalitis Society? I can't remember whether you needed much support.
I wasn't. Well, I was. I didn't. It wasn't a case of that. I didn't. They didn't offer support. They were lovely. But one of the things I found with encephalitis was reading some of these stories of people on there. It's not all. I think I realised how lucky I've been in that. And it's kind of in a situation like, say, when I stopped working, my husband was able to still pay the mortgage on our house. Yeah. Not at that situation isn't for everyone, is it? And I think when I felt very down at the beginning reading the Encephalitis Society, some of the people's stories in there aren't
tough, aren't they? Yeah.
You realise how lucky I am, and at the same time, I think I think it's one of those things down the line. I will go on it and sort of like our conversation today. Have
you written your story? Yeah, a positive story.
No, I need to, and I need to.
Well, you're helping out today anyway, aren't you? With doing
I think actually we've talked about looking and writing about on the encephalitis. Yeah. But Yvonne didn't feel ready. But no. You said now that you've made the progress and she feels she could give positive.
I think like my life has moved on now a little bit more positively kind of thing as well. And sometimes it's quite hard, I think, at the beginning to dwell on how many things you can't do. Yeah. But actually I found that really, I was almost like ignorance was bliss, just pretending in a weird way that.
Yeah. Now we've had some questions sent in from our listeners, I think. Is that what these are? Yeah. Okay. So let's see what we have. This is a good question. So Katie in Nottingham has asked, can you get herpes encephalitis even though you don't get cold sores? And the answer is yes.
Yes.
So
Definitely.
basically, this virus, probably about 70% of people have been infected with the virus. So if you go into a room of 10 people, 7 of them will have been infected. But in most people, it's just hidden away in a nerve and you don't know anything about it. In some people, it causes the cold sores. That's relatively common. In some, it causes the brain problem. But you can certainly get herpes encephalitis without the cold sores. And then she said, if you do get them, cold sores, are you more likely to get encephalitis? No, there's no link. So it's not as if somebody who has problems with cold sores is more likely to get encephalitis. It's just, we're doing research here in the labs. We're actually in our labs here in Liverpool trying to understand what is it, why is it that some people, if we've all been infected with this virus, why is it that some people develop this herpes encephalitis problem? And we're looking at the body's host response, the body's defenses, because we think there may be some clues in that. And we have some models. It's a Sunday, so thankfully there's not too many people here, but there are people here working. And we have some tissue culture models, especially that some of the team are working on, where they put the virus onto nerve cells which are growing in a plate and look at the response of those cells and see, can we understand from that why some people have this bad response to the virus? Should we move on to our next question?
Yeah.
It's quite exciting, isn't it? Okay. Edith in Manchester. Hi, Edith. Nobody tells us how old they are, but anyway.
Oh, my mum's name was Edith.
Oh yeah, no, it's not your mum. Yeah, why do some people get encephalitis? Is there a reason, or is it random? It looks random, but things are never random. There's always a reason. It's just we don't yet understand it, and so yeah, I think that's the answer. What's the biggest challenge to recovery? What would you guys say is the biggest challenge to recovery?
Definitely fatigue, which is one of the biggest problems in moving on. It does improve, but the first year or the first 18 months, they need to sleep, blasts of sleep all the time, which are beyond your control. Like, even if I'm really run down and tired, I'm addicted to Chase, say, for example. So
Right.
I watch that in the afternoon, and the amount of times when we sit in the afternoon and I'm actually really enjoying what I'm watching, I can fall asleep
Right. Yeah.
just at that minute. And it's not for long sleep.
Yeah.
It's weird. It's like a shutdown. So I think fatigue, and then the other challenge would be finding your ways around the fact that your memory isn't quite as good as it used to be, and it's accepting that and thinking, right, how can we actually get round it and find ways, because that just triggers your memory. I think that's once you found those kind of little pathways, that's when you start to feel normal.
Yeah. Okay. I just come back to the question about why some people get it and some of the work that's being done. So some of the studies so far have shown that this is actually severe herpes encephalitis in children. So there's a small number of children who actually have a genetic change in their DNA, their makeup, which makes them susceptible. It's a very early step in the immune response. And so I think studies like that just show us that, eventually we will understand exactly why people get these kind of diseases, and we may even be able to do something to stop it happening, because importantly for herpes encephalitis, for herpes virus, there's no vaccine. Earlier on today, Dr. Ajit was talking about Japanese encephalitis, and there is a vaccine for that, and we've been doing a lot of work in Asia, vaccinating children so they don't get it. But for herpes simplex virus, we don't yet have a vaccine. Okay, we have a question from Pip. Pip says, what message would you give to other clinicians, and why is so little understood about encephalitis? Well, so the message for clinicians is to think about it early on, to have a low index of suspicion. It's a rare disease, but the problem is if you don't spot it early on, then it can really have very bad outcomes. And even though herpes simplex virus encephalitis is rare, when you put together all the things that might be encephalitis, so people presenting with fever and strange behavior or a seizure, that becomes quite a big group of people. And so we do want people to think about, could this be a brain infection, and to get the patient to hospital as soon as possible. And why so little understood? Well, thanks. It's probably because there wasn't that much work done on encephalitis until recent years. We've over the last 15 years or so, the Encephalitis Society has done an enormous amount to support work done in terms of the research. We've done a lot of research here in Liverpool, but there's other work going on around the world. And so we are improving our understanding of all these conditions, and it's great to see that there are, changes are happening. I had a question, somebody sent in a question yesterday actually, so I don't remember his name, but he was asking about herpes encephalitis in children, and sadly his child had it taken a while for anyone to think of herpes encephalitis and to get the child started on treatment, and so the outcome had not been so good, and this child was left with quite severe brain damage. And his question was around, are there any differences between adults and children? I think the main messages, both for adults and children, are that doctors need to think about encephalitis, and if they have suspicion, get the patient to hospital, get them started on this antivirus drug Acyclovir whilst we do the test to work out whether it is herpes or not. Another question here. There's a lot of questions coming in. I wonder how many people do you think are listening to this? I thought it was Mark, your husband, my man, and that was it. Okay. Rebecca Dion via Facebook, so we're on Facebook as well. How long does it? How many? Say again. 60 are watching at the moment. That's great. So somebody called Rebecca has said, how long does it take to fully recover from encephalitis? Well, you're 2 years in now, aren't you? Two years in. I always tell patients that things will continue improving slowly. Unfortunately, some people don't fully recover. They don't get quite back to doing exactly what they were doing before. But I think the important message is that you do carry on slowly improving, and as we've seen, if you have a positive outlook, you will continue to make progress.
Definitely, as I think, don't lose hope. But I think if at the end of the first year you feel, my God, is this as good as it gets? It does get better. You do make progress, and you don't kind of believe that. I thought people were saying that to try and make me feel better about it all, but definitely suddenly little pennies begin to drop. It's lovely. It's nice. The second year is much better.
Yeah. Thanks very much. And we have a question from Sarah. Where's Sarah from? Is it Latin? We don't know. Do please let us know where you're sending your messages in from. Sarah says she's a recovered sufferer of herpes simplex encephalitis. Could it happen to me again? So most people who have herpes encephalitis don't have it happening again, but there are a small number who have a relapse. Usually, if we see that, we see it several weeks after the first infection. And some recent work has shown that the relapse is probably not so much the virus, but it's a late immune response to the infection. So people are making antibodies against the virus, and that then is actually also causing further brain damage. And there's a small number of patients who have one of those antibodies is called the antibody against NMDA, which is a receptor in the brain. And we'll be hearing more about NMDA encephalitis later on this afternoon when we hear from a story from a patient in the United States. So early relapse is probably related to this antibody production. But there's, if you've had no herpes encephalitis for a couple of years, is that the chance of having it again is very, very small. So Kerry, who's not telling us where she's from, Nicola, are you able to when it comes in? It's a one-way. Okay. Well, do if you can let us know where you're from. And maybe how old you are. But anyway, Kerry says, can stress be a big factor in the cause of herpes encephalitis? I mean, it's interesting because you had this stressful day or two with it was stressful at work, and then the dog died.
I think it's funny that you said that. I was saying dog all the time in hospital. Because that kind of...
Yeah. Do you remember that? I haven't made it up. Do you remember? Did she say dog, or have I made it up?
There was some text. She wrote some texts, and they included the dog.
Yeah.
There was a bit of a focus on the.
I'm sure. I think. I mean, I have a bad memory, but so I'll have to check with one of the juniors. But I think I remember this because it was like this English teacher, and every question the answer was dog. And it was like.
It began with the dog. Said, I think with reference to yourself, you were calling yourself referring to yourself as the dog.
Yeah.
Yes.
No comment. So Kerry's asked about stress, and interestingly, quite often when you talk to patients who've had herpes encephalitis, it seems like there was some stressful events that maybe happened in the run-up. But it's hard to know because often, if you ask anyone about any anything bad that's happened to them, they can often relate it to some stressful event that happened. You know, I crashed the car today because yesterday, you know, I had a big row with my boyfriend or whatever. But so we don't really know whether it is or whether it's just that people look for causes. I hope that answers the question, Kerry. Okay, Mitch. Says, did the effects of encephalitis worsen with age? I'm 32.
Well, I was 40, so
Yeah.
I don't know. Yeah.
I think he means, will he continue, will things get worse as he gets older, maybe? I mean, I think first few years after you have encephalitis, we see people you know, improve and continuing to improve over some time. And then I don't know, I mean, all of us, our memories go a little bit as we get older in years. And perhaps people with herpes encephalitis are slightly more vulnerable to that because they've lost some critical parts of the memory. But I think at 32, you've probably got many years until, you know, old age would be a problem for you.
I believe, I don't know if I'm right, that you do some recircuiting in the brain as you heal, in which case some of the brain would take parts of
absolutely
jobs over,
and that's what
wouldn't
we've
they?
seen, isn't it? So for a while you're unable to remember some things, and then you set up new circuits. The younger you are, the more likely that is to happen. So kids, we know, are, you know, brilliant at their brains are continuing to grow, so they cope with all sorts of insults. As you get older, it gets harder, but I mean, clearly things do recover. You're just remind us, at the Walton, you're on the, which ward are you on? The Walton is the neuro centre.
Radiographer.
You're a radiographer
so
at
we
the Walton
do
Centre,
scan a number of patients with brain injuries, of
Right.
which we do have people with encephalitis come through occasionally. But it's different having a patient as opposed to having family members.
Of course.
You don't really understand it until it strikes your own family. So it's helped with when I deal with patients coming through.
Is it affected now the way you deal with patients? In what way?
I think it's just a bit more caring. Well, not that we're not caring, manager. We are caring, but if you have an understanding and appreciate...
You understand when people look normal, it doesn't mean that everything's smooth.
I think so,
Let's see what we've got here. Alan from Derby. Thank you, Alan. How's your team got on this weekend? I've got a mate called Tony who supports Derby. It's a very depressing business for him. Is research being conducted on a wide range of areas of encephalitis, such as SSP and encephalopathies? Yes, very much so. So we've talked mostly about herpes encephalitis today, but we've been running a national study called Encef UK here across the UK, where we're studying all forms of encephalitis, and any patient who has suspected encephalitis goes into the study. Broadly speaking, what are we doing? We're trying to, well, one of the things we're trying to do is improve the early management so that doctors, nurses, healthcare workers are very good at seeing people who may have encephalitis and getting them very quickly onto the right treatment pathways. But then we're also looking at the patients where there is no obvious cause, trying to do further studies to work out what the causes might be. And as well as just looking directly for the pathogen, for the bug itself, so looking for the herpes, it may be that even if you can't detect the bug, you might be able to show that the body has responded in a certain way to a particular bug. So we're looking at the host response patterns to see if they give us clues about what the cause was. Alan's mentioned SSP, which is something called subacute sclerosing panencephalitis. It's a mouthful. It's caused by measles virus. We don't see so much measles now because thankfully most people are vaccinated against it. Although there are some people who don't believe in the vaccination, and there's a bit of controversy around that. There's been, in the States recently, there's a big outbreak going on because people haven't been getting vaccinated. And we've had problems in Wales a couple of years back, not enough people were vaccinated, and we saw measles outbreaks. And measles causes a rash in most people, but again, in some people it gets into the brain and causes a brain infection. And in some of those, the brain infection is this thing called SSP, which happens years after they think they've recovered. So they've recovered from the measles rash, and then years later they develop an encephalitis, which is very hard to treat, SSPE. But we had a patient here, a young lad who we tried to treat at the Walton Centre years ago with a cocktail of new antivirals, who initially did very well, and then we were giving the antivirus drug straight into his brain, so it was all very complicated. and the shunt, the routine, got infected, and we had to stop doing that, and then he went downhill very quickly afterwards. So SSP it's a bad one. Encephalopathy. So this term encephalopathy just means that the brain is not working properly, and viruses cause it, bacteria cause it. There's a range of causes, and so, like I said, we are looking at the broader picture. Yeah. Hope that answers your question. Thanks. Sarah from Solihull. Do they have a football team in Solihull? I don't know. Nobody knows.
Don't recognise the scene.
No, maybe in a lower division. Maybe she's not into the football. Should I have received post-encephalitis care from the hospital or from my GP? My aftercare was very poor. I take multivitamins to help with fatigue and suffer spikes in my body temperature. Is this an issue post-herpes encephalitis? Well, thanks for giving us so much to think about there. Yeah.
So the body temperature thing, I totally get. That drove me bonkers. I used to be hot in the day, really hot. And still, even now, post-encephalitis in winter, walking dogs, I basically have an open coat. I can feel really hot.
Mm-hmm.
But then in the night time, I would be freezing. And this was in the middle of summer. So my poor husband, I would have the full quilt on and thermal pajamas on, and absolutely felt brick cold. And if I didn't do this, I actually couldn't sleep in the night.
Right.
It was like the whole body temperature thing has gone a bit.
Yeah.
Now it is better than it was. Now it's not as bad as that at all. But in that first year,
Interesting.
I didn't seem to be able to know. I don't know. My brain's view of my body temperature was.
Did you ever record your temperature, see what it was? You know, when you felt hot, and you shouldn't have felt hot.
No, it was just felt it was just absurd. It just made a
Right.
big difference into
Yeah.
you just look strange in winter.
Right, going out in your your skimpy clothes.
Still now, like
in
walking
Liverpool, you should try Liverpool on a Saturday night. It looks normal to me.
So yeah, I get the body temperature thing completely. It's bizarre.
So, but that you feel that's settled a bit.
It's settled, but still, like, I walk to work in winter in the morning and I have to have my coat open. Walking with
Yeah.
my daughter who's got a hat and scarf
Yeah,
all up, and I just have my coat open, holding my hands.
I mean, it sounds like it still is a problem for Sarah. We don't know how many years post-encephalitis she is, but it's, at least in you, that improved over time, so that is encouraging. This issue about post-encephalitis care is an important one. It sounds like you had very good support.
Mine was amazing. I mean, I met you regularly, and that you were very supportive when I had like issues, even with my employer at the time, in understanding, because I had an occupational health review from someone who didn't understand encephalitis, and then I had your support there. It was fantastic. And then we had at the time a brain unit in a hospital called Mossy Hill Hospital, which by sheer fluke was close by, and that was where I had speech therapy was fantastic there, and what she actually did was reading and writing with me. I don't know whether that's standard or she talked about memory with me. That's one of the people who really stands out.
So you had very good support. I mean,
Amazing.
and unfortunately, it's not as good across the country. And one of the things we're trying to address is this. In fact, the Encephalitis Society is very good at providing additional help to help you get the support you need. So often it's about navigating your way through the system. I mean, I think in this area you're lucky because we know our way through the system. She says her aftercare was very poor, so that's unfortunate. Multivitamins, I have patients who take those. We don't really, there's no evidence one way or another about how much help or how much difference they make. But if people find them helpful, then I would certainly take them. Here's a message from North Wales, a 25-year-old who was a nurse. She's not given us her name, and she said, a very good question, why is steroids used for herpes virus when they suppress the immune system? Is there any evidence this virus is linked to being autoimmune? So you're right, this is one of the anxieties about using steroids. They suppress the immune system, and so could they allow the disease to get worse? They're only used during the very acute illness when somebody's really unwell and the brain is swollen, and we worry that it's going to swell so much that there'll be severe damage. So, but we don't know really whether they should be used or not, and that's why we're doing this national study, which is called DEX-NCEPH. So that should hopefully answer that question about whether they're helpful or not. Is there evidence that the virus is linked to being autoimmune? not quite sure what that means. I mean, there's a range of autoimmune diseases where the body, in trying to defend itself, causes problems. So things like asthma, to some extent, is that, and eczema. I think the virus itself can cause direct damage. We know that, but sometimes it also causes additional problems from stimulating the immune system. So I guess in that sense, then the answer is yes. Here we are. This is Sarah, 33, from Sheffield. My mum was fit and healthy at 63 and was struck down with encephalitis suddenly. She's experiencing strange sensations, feels like her body is drained of energy. Is this normal during recovery?
Yeah, it really is. I think just your energy levels just go through the floor basically for that first year, and the need to sleep. I think it's just your body does need to recover. And I would have basically, I would get up in the morning and I would help my daughter get ready for school. My husband would take her to school at the very beginning. And then at 10 o'clock, when my dad was there, and I then could fall asleep at 10 o'clock, tired, then recover for another little bit, have some lunch, have a little afternoon sleep. And it was basically dips. It was just basically chronic fatigue, but it almost bizarre because it was something so small would take it out of you.
Yeah.
And that does improve, definitely. But yeah, lack of energy at the beginning is very, very strange feeling.
We do. There's one last question from Sarah. Shall we try and squeeze it in?
Yes, go ahead.
Okay. Sarah in London, what are the most usual environmental triggers? As I understand, it's not always a viral trigger. That's absolutely right. So sometimes it's a virus, but there's a whole range of causes of encephalitis where we don't actually detect a bug at all. And then it's the body's immune system attacking the brain. And we're doing research to see what the triggers are for that. So thanks, Sarah from London, for that last question. Thanks to all, was it 600 people that were joining us across the country? Thanks very much to Yvonne and Lisa for joining us and sharing your story with us.
And thanks to you, Professor Solomon, because my life wouldn't have been the same without you. And I mean that.
Oh, well, thanks. That's
Thank
very
you.
nice of you to say it. Okay, good. And that's a wrap.